Anna is 51 years old and extremely worried. When visiting her doctor for her annual mammography, a small suspicious-looking entity was found. Anna is really afraid at the moment, and a lot of things are going through her head.
I will lose my hair. Will I survive a surgery? Chemo? Will I die?
Anna, there is no need to panic now. We will first perform a specialized ultrasound examination to determine whether this is a malign tumor at all. Also, treatments have become so much more sophisticated today. Even if you should have a small tumor, we might not need to perform any of the treatments you have in mind. The doctor performs a thorough ultrasound examination of Anna's breast to get a closer and three-dimensional look of the suspicious area. The lesion I can detect is very small and only about 3 millimeters in size. I'm confident it may not be such a big problem. At this point, I still can't tell you with certainty if this tumor is malignant or not. So what we'll do is, we will take a small tissue sample, give it to a pathologist, and let him do a detailed analysis to give us certainty. Nevertheless, at this point, and in your case, I will recommend that we mark the suspicious lesion and first take time to observe before embarking on any treatment.
What do you mean by marking the lesion? I don't understand it.
We can implant small, so-called markers in your breast. These little implants will help us locate the suspicious area by ultrasound or mammography at any time we want to follow up on it. By visualizing the lesion or suspected tumor in relation to the marker, we can tell whether it has grown or maybe just healed by itself. Who knows, your body might get rid of it.
What are these markers like? Can I feel them?
The present-day markers are tiny pieces of differently shaped metal, so they can be better distinguished.
Is this really common practice?
Yes, in fact, millions of women have their breast fitted with such markers every year, simply because we've realized that in certain cases, it is better to wait and observe how a suspected tumor develops rather than rushing patients into chemo or surgery.
And do these markers have any side effects?
Well, I should admit that today's markers are far from perfect, but they are presently our best tool to avoid over-treatment and subjecting you to the massive inconveniences of surgery and chemotherapy. In some cases, markers have been found to migrate, and they may cause pain during a mammography. Admittedly, not really what we want. And some patients have reported discomfort when, for example, wearing a bra.
Actually, I really don't like the idea of having metal spikes in my body. Will they be removed, or will they stay there for the rest of my life?
That is unfortunately so. Unless the tumor grows and we decide that a surgery is required, they will stay in your breast. I'm aware of these drawbacks, and we doctors are waiting for better options to offer to our patients. But for now, the metal markers are your best bet and standard care. SurgMark is a German medical startup that has developed a marker, SchurSign, that overcomes all these drawbacks. Their new marker is made from a biomaterial. It is soft like gelatin. You don't feel it. It stays in the right place, so it never migrates, helping doctors to do a correct evaluation. It is biodegradable, so it only stays in your body as long as it is needed and useful. It can be visualized by ultrasound and other common image examinations like mammography and MRI. Moreover, this marker is also seen in pathological preparations. In these cases, it can be very easily cut to prepare the tissue samples. SurgSign, however, is not yet available for women, but you can change this and be part of making breast cancer diagnosis a less painful experience. Help SurgMark's doctors and scientists realize this dream. Donate now and support us in providing women around the world the best care and a pain-free experience. We truly believe women deserve it.